What I'm going to be presenting on today are the planning considerations that folks that are in your position right now need to consider in looking ahead. The first among them is the advanced medical directives. Okay, this is strictly for healthcare decisions. And those documents include, it's a threefold thing. You have the healthcare power of attorney, you have the living will, and then you have kind of an offshoot document called the DNR CC. Who knows what a DNR CC is? Okay. Who's had to actually act on a DNR or activate a DNR CC? Okay. And that's a very tough decision. The DNR CC is, and we'll talk about it in detail, it is a document that specifies exactly what you want and don't want, right, for end-of-life care. Let's talk first about the healthcare power of attorney, okay? What this does is it delegates the power to make medical decisions. That's it. And each and every medical decision that you can make, your agent who you appoint under that instrument can make for you. Now, when can that agent act? Exactly. Very good. When you can't. Only when you can't. It's different from the durable power of attorney that we're going to talk about in a couple of minutes, which is a financial instrument, a financial power of attorney. The healthcare power of attorney, agent can only act if you are unable to make informed medical decisions for yourself. In that manner, it's actually kind of like what I would consider a springing power of attorney. The authority of the agent only springs to life when the principal person can't actually make those decisions for themselves. So it's a springing power of attorney. Very, very, very important, especially with, anyone heard of HIPAA? Right, yeah, okay, if you're in the healthcare field or been dealt with the healthcare field, you know HIPAA, okay. The funny thing is that the healthcare power of attorney does not have a HIPAA waiver in it, so your agent can actually communicate. Now, most hospitals, healthcare companies will honor the healthcare power of attorney without an express HIPAA waiver in it. Okay, so I don't want you to worry about that. At my law firm, we actually do put in a HIPAA waiver into the extra verbiage portion of that healthcare power of attorney. Okay, so really any healthcare decision that you can make, your agent can make for you. The living will. This is a declaration, okay? This is, again, part of the healthcare advanced directives. The healthcare power of attorney names someone who can decide for you. The living will is a declaration that simply states, if I'm terminally ill or if I'm permanently unconscious, that you're going to implement a certain healthcare protocol at the end of your life. And you're ordering your physician to withhold or withdraw the treatment of artificially supplied nutrition or hydration. And that's if you're permanently unconscious or terminally ill. Okay? You're telling them to issue a DNR. Okay, that's that other form, the DNR CC, the DNR. You're telling your physician in that document, hey, if I'm in this condition, activate the DNR protocol. Essentially, comfort care. Just keep me comfortable, relieve my pain. Do not artificially prolong my life with nutrition and hydration. You know, a G-tube or an NG-tube, any of these artificial means to keep you going. Okay? Now, two doctors are the ones that basically, two doctors have to agree, hey, this person is terminal, this person is permanently unconscious, and so two doctors agree, hey, and that's a pretty reasonably high degree of medical certainty. Reasonably, right? Who here is uncomfortable with two doctors? Maybe they want 3 or 4. Agree. Yeah, I'm ready to go. I'm terminal. I'm permanently unconscious. It depends. You know, a lot of my clients' comfort level with the living will stems from their experience in the healthcare field. You know, if I've had some nurses and physician clients who are scared to death about that discretion. They are scared to death because they have been in that their entire lives and practicing. And they see that a lot of healthcare professionals, depending on what that person has done in the healthcare field, may have very, very strong opinions about when to call it. Okay, I see a lot of heads nodding, right? And that can vary widely. I have kind of an interesting side note. I serve as a guardian over a gentleman who is mentally retarded, developmentally disabled, I apologize, developmentally disabled. He's a paraplegic, And I've been his guardian for the last, it's been about 8 years now. I took over from another guardian who was an attorney in our office, a wonderful gentleman named Ray. And he lives at a group home. He's lived there most of his life. And I got a call from St. Anne's, and Ray had been cycling in and out of the hospital ER. He was having a lot of breathing issues and just a lot of problems. And the hospital called me over to make a decision and said, okay, Ray's got this infection, and he's on BiPAP and these different interventions, and well, we think it's time to basically pull the support. And I went over and I met with the ER doc, and he was just full, we need to pull it. We need to just, nope, he doesn't have quality of life. I could really, really sense his looking at that patient, and he knew Ray because he was in and out of the ER. I sensed his, I don't think we should bother extending Ray's life. And that broke my heart. And Ray is just, I'm his guardian. I don't know him personally. I know him personally now, but, I don't have any ties to Ray other than that. And I did end up ordering certain things to be done. He was intubated, and they did implement then this treatment. And he bounced back, and he's been doing actually pretty well. So you do have to be cautious, okay? You do need to know, okay, who's counseling me on these decisions? And these are tough choices. Again, even in a situation where it wasn't a family member for me, and having to make that choice about someone continuing to live or not is a very, very difficult one, okay? The living will goes a long way to clarifying, though, your wishes for the end-of-life care, okay? Very, very important document. Oh, joy. Okay, this is probably the most confusing form. The DNRCC, so this is do not resuscitate comfort care, okay? The living will in the text of it actually says, okay, if I'm in a terminal condition or permanently unconscious state, I am ordering that my doctor activate a DNR. Okay, a DNR actually has to be activated by a physician. If you have a terminal diagnosis, some of my clients do, like have a very advanced heart condition. Some of them actually have an active DNR, like in their vial of life in like their apartment. When I used to work in an assisted living center over in Westerville, I had some of the residents actually had active DNRs because they had advanced heart conditions, and so everyone at the care facility knew, and the ambulance company knew, okay, if this person arrests, we're just keeping them comfortable. We are not, basically trying to resuscitate at all, okay? So at the bottom here you see, okay, so if you check a DNRCC, that means immediate comfort care, okay? And if you check DNRCC arrest, the comfort care measures are only implemented in the event of cardiac or respiratory arrest, okay? So it's slightly different in that way. And I know it's a very, like hairline difference in a lot of cases. You can't always tell, why is this person not responsive or not, so it's very, very difficult. And I see a lot of the folks that are in healthcare saying, yes, it's very difficult, this is tough. And what I suggest that you have is healthcare power of attorney and a living will that says, hey, if I become terminal because of something that arises in the future, let a doctor issue a DNR, because that's what I would want if I were in that condition. You're not in that condition at the time, but that's what I've done. And I'm 41 years old and healthy, but if I were in a terminal or permanently unconscious state, I wouldn't want to be artificially maintained. So, and again, that's a personal choice. The durable general power of attorney, I mentioned earlier that the healthcare power is like a springing power, right? That only becomes active when you cannot make informed medical decisions for yourself. Now, the durable general power of attorney, this is a financial document which says, hey, I'm appointing this agent to manage my business affairs. Okay? Not just strictly financial, but really all forms of business. And typically it's used when someone's debilitated, right? Or can't make those decisions for themselves, but not always. Sometimes you're just unavailable. And it does delegate that power to enter into all of these different kinds of transactions and business things, banking and investments and so forth. This is a power. This is a document that actually opens you up for potential misuse, right? Because that agent's given a lot of power over your finances. It's very handy, because if you can't do those things, manage your own financial affairs on your own, you really need to have someone that can do that. And here's the rub, okay? I mentioned the springing power of attorney. They used to do springing financial powers of attorney. But